Hello people, in this video let us look at MCQs on ParaNasal Sinus, okay. The question here, ParaNasal Sinuses present at birth are, the options are Frontal, Maxillary, Ethmoid, Maxillary, Frontal, Ethmoid, Sphenoid, Ethmoid, okay. According to the information that is available latest, all of them are present at birth, isn't it? That's what is updated. All of them are present at birth. Maxillary, ethmoid, sphenoid, frontal. And according to the textbook, definitely you can choose maxillary, I think, right? And the next to maxillary will be ethmoid. So the answer here is ethmoid and maxillary, okay? Let us look at the explanation that they are giving here. The answer here you can see is 2. Let us look at the explanation they are giving here. Paranasal sinuses develop from outpouchings from the mucous membrane of a lateral wall of the nose. The growth of sinuses continues during childhood into early adult life. Radiologically, maxillary sinuses can be identified at 4 to 6 months, ethmoids at 1 year, sphenoid at 4 years and frontals at 6 years. So they are just going for the best 2 here, isn't it? Okay, they are choosing the best answer. The next question here is maxillary sinus epithelium is, so your options are squamous, non-ciliated columnar, keratinized squamous, ciliated columnar. Somehow ciliated columnar seems nice to me and keratinized definitely not. So amongst these two, the answer is ciliated columnar, okay. So the answer is ciliated columnar. Okay, so it's in green. So ciliated columnar will be something like columnar, isn't it? Something like this it will be, columnar with cilia, isn't it? So this will be ciliated columnar. Okay. So here you have the maxillary air sinus shown here. So this will have what epithelium? Ciliated columnar, okay. The other maxillaries here, they'll have what epithelium? Ciliated columnar. According to the textbook, mucous membrane of paranasal sinuses are, what are these? These the paranasal sinuses are lined by mucous membrane which is continuous, okay, with that of the nasal cavity. It is thinner and less vascular compared to that of nasal cavity. Histologically, it is ciliated columnar epithelium with goblet cells which secrete mucus. Okay, so what is it? Ciliated columnar epithelium with goblet cells. Some extra words here, with goblet cells which secrete mucus. Okay, cilia are more marked near the ostia of sinuses and help in drainage of mucus into the nasal cavity. That is the job of the cilia. Look at this one. A patient presents with antrochoanal polyp arising from the medial wall of the maxilla. Which of the following would be best management for the patient? So here you have what? An antrochoanal polyp. So this is coming from what? Maxillary sinus. It is arising from the medial wall of the maxilla. Yeah. Which of the following would be the best management for the patient? So that they are talking about the management, treatment, etc. The options are FESS with polypectomy, medial maxillectomy, TEM, Cadwell look procedure, intranasal polypectomy. So what is the answer? We have heard a lot about FESS, isn't it? So let's look at the answer here. It's A, that is functional endoscopic sinus surgery, isn't it? So look at this, antrochoanal polyp. So basically, it's coming from the maxillary antrum. So basically these nasal polyps are non-neoplastic masses, okay, of edematous nasal or sinus mucosa. So there are two types. There are antrochoanal polyps and bilateral ethmoidal polyps. Two types of polyps are there. The antrochoanal one that you are looking at, this one is actually from the mucosa of the maxillary antrum, okay. So this arises from the mucosa of the maxillary antrum near its accessory ostium. It comes out of it and grows into the choana and the nasal cavity. So it will have 3 parts, the antral part, the choanal part and the nasal part, okay. When it comes to the treatment, they are talking about the endoscopic sinus surgery. Okay. So it is superseded all other types of polypectomy, etc. The other things they talk about in treatment is Cadwell look operation, etc. for recurrent cases. So mainly you have to do what? Endoscopic sinus surgery. How's it going, people? Shall we move to the next MCQ? Which of the following is false regarding frontal sinusitis? False. So, about the frontal sinus they are talking about. So, where will be the frontal sinus? Somewhere here, isn't it? So, pain shows periodicity. Most common sinus involved in infants and children. Pain is referred to as office headache, isn't it? It's covered here. What is it? Office headache, yes. And then, tenderness is present just above the medial canthus of eye. So, let us see, this is a false statement they are asking. So, 3 statements should be correct, isn't it? So, let us see what. Tenderness is present just above the medial canthus of eye. Just above the medial canthus of eye. Sounds about right. We will think that this is right, okay. Pain is referred to as office headache. Yeah, because it kind of drains once you get up, isn't it? Then, amongst these two, pain shows periodicity. Yeah, when you get up, it starts draining, isn't it? So, there will be pain with periodicity. Most common sinus involved in, okay. So, the answer here is 2. So, 2 is the incorrect statement, okay. Most common sinus involved in infants and children is which one? So, the most common actually involved in infants and children is, according to the textbook, it says ethmoid sinus, okay. So, more about frontal sinus. Frontal headache shows periodicity, tenderness, edema of upper eyelids, nasal discharge, X-ray, opacity of affected sinus, CT scan is preferred, okay. Hello people, moving on to the next question. The most common site of leak in CSF rhinorrhoea is, so options are sphenoid sinus, frontal sinus, ethmoid sinus, tegmen tympani. So let us look at this. So sites of leakage shown here. So frontal sinus, okay, from frontal sinus, ethmoid sinus, sphenoid sinus, like this way, okay, and eustachian tube. So basically they're talking about CSF rhinorrhoea, isn't it? Into the nose. Okay. This question actually doesn't specify, okay, it specifies rhinorrhoea, okay. So via the nose itself. So what is the answer? Answer is 3, ethmoid sinus, okay. So ethmoid is where? B. So this is the cribriform plate, isn't it? Ethmoid sinus, okay. Actually, they are saying that the most common cause will be trauma, iatrogenic surgery, like that, okay. So that's what you should remember also. Moving on to the next question, guys. Opening of posterior ethmoid sinus in. Posterior ethmoid sinus will open in which of these? Inferior, superior, middle, meatus. So they are asking about posterior ethmoid sinus. Here it is, posterior ethmoid air sinus. Where is it opening? Here. And what is this? If this is inferior, middle, superior. So this will be superior meatus, isn't it? So the answer is 2, superior meatus. Okay. Let's move on. Okay, the next question here, all are major symptoms of sinusitis except, this is an except question. So, nasal blockage, facial congestion, nasal congestion. Aren't these two same thing? Nasal blockage, nasal congestion. Somehow they seem to be the same. So, definitely both of them have to be right. We need only one wrong answer. Nasal congestion, facial congestion, halitosis. What is this halitosis? This is bad smell from mouth. Okay. So, usually this is caused by infected tonsils, etc. It can also because of lot of other reasons like post-nasal discharge, malignancy of oral cavity, oropharynx, etc. But in sinusitis, I think this is not there, so this is the answer. Facial congestion can be there. So look at the answer here, 4. Halitosis. Halitosis is bad smell from mouth. Okay. Look at this one. This is a very irritating question. Just leave this part and say complications of acute sinusitis are, okay, I think they just try to complicate the whole thing. Acute sinusitis, orbital cellulitis, spots puffy tumor, conjunctival chemosis, subdural abscess. See, if you remember, in our video on complications of sinusitis, we have looked at the complications, right? There we have seen all these terminologies, spots puffy tumor, orbital cellulitis, subdural abscess, all these words are there, isn't it? So what is the question here? Complications of acute sinusitis are orbital cellulitis, this is correct. Spots puffy tumor is correct. Subdural abscess is correct. What about this conjunctival chemosis? Let's look for that word there. Something to do with the orbit or the eye. Conjunctival chemosis, isn't it? There is no word like that here at least. Wait. But the answer here is actually all of the above. Okay. So actually the whole question was something like this. ABC, something like this. All of the above is the correct answer. That means all the 4 are correct, isn't it? A, B, C, B, C, D. That means all A, B, C, D, all are correct. So all these are complications of acute sinusitis, a very irritating form of question. Anyways, all of the above is correct, okay. Shall we move on? Do you remember this complications of sinusitis, what spots puffy tumor is? Do you remember this diagram where we have shown the spots puffy tumor? See, this is spots puffy tumor only. Spots puffy tumor here, below the periosteum, isn't it? The main words that should come out in complications of sinusitis will be like mucocele, guys. Mucocele you should know, okay. Orbital complications, local complications, orbital complications, intracranial complications, descending infections, focal infections, all these we have seen. For mucocele we have seen photo also, wait. So mucocele of frontal sinus, okay. This is showing some osteomyelitis of maxilla. What is this? Fistula. Orbital complications. Yet another question, very similar. Complication of sinus disease include retrobulbar neuritis, orbital cellulitis, cavernous sinus thrombosis. Yes, we have seen this one also. Or superior orbital fissure syndrome. Yes, we have seen this. All of the above. So all of the above sounds about right in this, because if 3 are right, isn't it? Retrobulbar neuritis. So answer is 5. All of the above. 5 options. Wow. Again, going back to this complications of sinusitis, our video slides, there you can see orbital, superior orbital fissure syndrome, cavernous sinus thrombosis. What about that retro something was there, right? That is not written here. Okay. What are the 2 things we are not having here? Retrobulbar neuritis. Retrobulbar neuritis, okay. Orbital cellulitis we have written here, right? Orbital cellulitis we had, okay. So all this we had, except retrobulbar neuritis. This will be like behind the eye, right? Behind the globe of eye, okay. That is retrobulbar. Shall we move on to yet another question? Are you ready for the next challenge, guys? Okay, look at this question. Which of the following is most common etiological agent in ParaNasal Sinus mycosis? Mycosis, something fungal, isn't it? Most common etiological agent, if there is fungus in the ParaNasal sinus, which is the most common agent? Options are Aspergillus, Histoplasma, and this complicated name Conidiobolus coronatus, Candida albicans. So the answer is Aspergillus. Okay. Do you remember these photos from microbiology? Aspergillus fumigatus, flavus and all that. So aspergillus you can remember. So other than this you can remember alternaria, mucor, rhizopus, etc. What and all do these cause in the sinus? They will cause fungal ball, allergic fungal sinusitis, chronic invasive sinusitis, right? All these terminologies you should know. Then one more word is there, fulminant fungal sinusitis, right? So what and all did you see? Fungal ball, then allergic fungal sinusitis, chronic, and then fulminant. Okay. Guys, another question is there on this fungal sinusitis itself. Look at this. Which among the following is true regarding fungal sinusitis? Surgery is required. Okay. So the next option here is, we are reading fungal sinusitis. So this is the topic. Most common organism is Aspergillus niger. Aspergillus is correct, but niger is kind of doubtful. Amphotericin B IV is used for invasive fungal sinusitis. Amphotericin B is an antifungal. IV, do you give it IV? Hazy appearance on X-ray with radio opaque. Seen only in immunodeficient conditions. See, fungus usually is immunodeficient, but it is not only. So this statement is definitely not right. Surgery is required for treatment. If there is fungus in the sinusitis, do you have to remove it with surgery? Then let us look at the answer. What do you think the answer is, guys? Definitely E should not be there. So these two should go off, isn't it? So one of these. So Aspergillus is correct, okay, but niger I think is not correct. So we'll remove B. So this one also we'll remove, okay. So either 1 or 2. So surgery is definitely correct, right? Because both have A. Then D is all definitely correct. Hazy appearance on X-ray with radio opaque. So what about, the only confusion here is against C, amphotericin B. Now what do you think? Amphotericin B, is it given IV? Let's go to pharmacology and check. So in our antifungal drugs, what have we looked at about amphotericin B? Amphotericin B. Hold on. It's a polyene. Look at this photo here. It looks like injection only. Bring to front. Amphotericin B injection intravenous. Okay. So some clue we are getting here, though we may not be 100% correct. This seems to be a right statement. Invasive and all, sinusitis, is it invasive? This much is correct, amphotericin B. So let's look at the answer. Answer is 1, yes, A, C, D. So we got it right, great. So surgery is required. Amphotericin B IV, hazy appearance on X-ray with radio opacity, right? Okay. So in Aspergillus fumigatus is more common than the others, okay. Are you ready to look at yet another question? Okay. Which sinus is involved in a patient with toothache and sinusitis? Maxillary, ethmoid, frontal, sphenoid. I feel like saying maxillary. What do you say? Maxillary teeth. We have maxillary teeth and all that, right? Answer is 1. Okay. Correct. So we have maxillary teeth and mandibular teeth, isn't it? Okay, look at this question. All of the following statements about CSF leak are true except, this is an except question, guys. Please pay attention here. 3 statements are true. Most common site of CSF leak is fovea ethmoidalis. See, ethmoid, cribriform plate, all that is correct only, right? Beta 2 transferrin estimation is highly specific for diagnosis. Beta 2 transferrin CSF, isn't it? Fluorescein dye can be used intrathecally for diagnosis of leak. Kind of sounds about right. You will give an intrathecal injection, is it? Fluorescein dye, then you can know where and all it has leaked. MRI gadolinium enhanced are best. This also sounds about right? Something is wrong, wait. This MRI gadolinium enhanced is a nice word, but this T1 something is a separate thing, looks like. Pulse sequences of MRI. Look at the content from the textbook here under MRI. They have this content, pulse sequences of MRI, T1 weighted, T2 weighted. What is this T1, T2? So MRI is what? Magnetic resonance imaging. So they are using some magnetic strength in the like Tesla. Okay. But what is T1, T2? This T1 and all is some time, guys, relaxation time. It's very complicated actually. So anyways, according to the textbook, CSF, Rhino or Hoya, location of site, if you want to know the site, you should use a MRI which is T2 weighted MRI, okay. So the answer actually should be MRI T2 weighted, okay. This is the correct answer. So this is useful in depicting the site of leak, okay. In general, to know the location of site, you can use CT, high resolution CT, MRI which is T2 weighted, intrathecal fluorescein study which you just now saw in the options, right? Then you can use other things which are actually banned now, like intrathecal radioactive substances, CT cysternogram which is intrathecal injection of iohexol, okay, but now it is not done much, okay. This terminology which is there here, fovea ethmoidalis, look at this. Fovea ethmoidalis defect, something they have shown here, okay. If you want, you can learn, okay. Look at the next question, or we'll do one thing, we will take up in the next video. It's way too heavy, right? So come back for the next video if you're interested, we will take this, okay. Bye guys.